Good evening to everyone. Thank y'all so much for joining us. I'm so excited to be here today to have a now friend and mentor, guru of regenerative medicine, Dr. Jeff Piccirillo and his wife, Mrs. Jennifer Piccirillo, here to talk with us about how regenerative medicine affects our sexual health and intimacy and how we can use that aspect of medicine to make it better. Also with us tonight is my honey, my boo, Dr. Akin Ojo-Carons.
Sipping
You
my
said
water.
we're going to be the strong silent type tonight, so
I'm sipping on my water, but I'm here. It's great. It's great to be here.
Well, you know, because this is something that in the last Jeff, we met in 2021.
right.
And it was
Correct.
around it's like October, the fall,
Yeah.
early fall of 2021. And so we are new kids on the block when you talk about regenerative medicine and how it impacts, or how it can impact sexual health, and what you can use, what you can do to improve your sexual health and sexual wellness. And you two are our gurus. And so I'm so excited to have y'all.
Yeah, it's funny that Dr. Charles Runnels calls me the OG of PRP.
Yeah.
So I guess I'll take that as a compliment.
Yes.
I think it is. I
Yes.
think it is. You know, so for those who are listening, what's PRP?
Well, so yeah, I'll tell you a little bit about kind of my journey, and that'll explain it all. In 2002, one of the big orthopedic companies that I used to do joint replacements with rolled this big machine into my operating room, and with the explanation of, while you're doing surgery, anesthesia is going to draw blood and we're going to spin it down. And at the end of the case, we're going to give you this little syringe of gold fluid, and it's really high in growth factors, and you can add it to your bone graft and your results are going to be better. And I said, I'm all in, but I had no idea what it was. And then over time, I started looking at it, and essentially that was the start for me of PRP. So PRP is platelet-rich plasma. So what it is, it's a derivative of your own blood, where we take a large amount of blood, anywhere from 30 to 120 cc's, and we spin it down to a small volume, anywhere from 6 to 10 cc's, and we concentrate the platelets into that volume. And by injecting that fluid into the body, we can help regrow tissue.
Mm-hmm. And you were initially using it. Your background is in orthopedic surgery.
Correct. Yeah,
And
so we were using it initially in the operating room. I mean, really the only on-label use, according to the FDA, for PRP is to augment bone graft in orthopedic cases. Everything else we do is essentially considered off-label. But people have been doing it now for over 20 years. And it started out with augmenting bone graft, and then it went into helping tendons heal, and then reversing arthritis. And then, you know, as you know, Dr. Runnels got involved about 12 years ago, and he was injecting it into people's faces, and then into their vaginal area, and then subsequently into his own penis. And because of all that, now we have hair growth in the O shot and the P shot, and the vampire facial and the vampire breast lift, and plus all the orthopedic stuff that we do with it as well in our practice.
And more seeing it in you know, utilizing medical spas, medical aesthetics, and so it's a very powerful tool. Would you say it is? You know, the way I like to think of it anyway is that it is kind of like the basis of regenerative medicine.
Oh, there's no doubt. It's the first thing that we had. I mean, it's really the start of it all was 20 something years ago. I did my first PRP case in 2002. So, you know, a little over 20 years ago, PRP is where it all started.
And what are some things that you've seen it do? I mean, I still get amazed, you know, and I'm only 2 years in, right, to really utilizing it in my practice. And so I'm sure you've seen so much more than we have. What are some of the amazing things that you've seen it do?
I mean, on the orthopedic side, you know, getting people back from surgery, 3 to 4 months ahead of schedule. Seeing things like doing nerve repairs after trauma and injecting the edge of the nerve with PRP and having it grow back, 40% faster than it's supposed to. And then more recently now, I mean, I think the one thing, and Jennifer's heard me tell this story, I think more times than not. And usually I'll cry when I tell it. But, when I met Charles Runnels now 6 years ago, the first thing he said to me is, he said, "Jeff, you don't know this yet, but we're going to do big things together."
Mm-hmm.
Mm.
And at that point in time, my business mind kicked in, and I was thinking, wow, this is a guy that is on the cutting edge, and he and I are going to launch products together and this and that. And when I opened up my own spa, and he came and spoke at my grand opening, and I remembered that conversation, and I related again, and over those 6 years, the big things that we're doing together is not financial, it's not business. The big thing is changing people's lives.
Mm-hmm.
Mm-hmm.
And it's truly, and it's not just, I mean, yes, it's our patients, but it's your life and Akin's life as well, because
Mm-hmm.
now you're getting away from traditional medicine where all we really had was people would come in, we'd make a diagnosis, and we give them a pill,
Mm-hmm.
to now a way to truly change their lives by having them regenerate tissue from within. And, sometimes that's getting lives back together and getting families back together and getting sexual partners intimate again. I mean, it truly is life-changing. We see that every day in our practice. I mean, people that come in and are struggling with either their hormones or their intimacy, and there's stuff now that it's not just, take an antidepressant or take a pill, or Akin knows as well, take a Viagra. That's not really the answer. That's not, it's not changing their life. It's just giving them a crutch to lean on.
So do you find that these methods, these regenerative therapies, do you use them solely as treatment, or you use them as adjunct with something else?
We use it mostly as treatment. But we address the whole person. I mean, our entire practice is regenerative. So we try to stay away from big pharma. We try to stay away from, most of the prescription drugs. Obviously, for some problems, they're absolutely needed. But in our practice, if somebody comes in, we try to augment what's going on with things like peptides or hormones and get their homeostasis better. And then if there's something that we can treat regeneratively, then we'll add those procedures on as well.
And so, Jennifer, if you had to say for y'all's practice, what's the name of y'all's practice, and what is regenerative medicine? Because we've talked about PRP, and with the word regenerative, renew. But how would you describe regenerative medicine to someone who's
so our practice is called Regen Ocala, in Ocala, Florida. And what the basis of our practice is to look at a patient as a whole, see where their deficits are, and then add what we can to help them heal from within. And I think that's what regenerative medicine is the way to address the body to get the body to heal from within. And that may be stabilizing their hormones. It may be adding peptides to help boost things like growth hormone so they can build muscle and build new tissue. Or it may be an injection of either PRP or fat-derived stem cells or bone marrow to help regrow tissue.
And you go ahead.
And I think also just helping them feel better about themselves, whether it's, an issue that they have with, their scars that they may have, like on their face, or for women, we're all conscious about our breast size or cleavage, and so we can also kind of regenerate, use that too, and kind of help them feel better about themselves.
Yeah, the reason I asked that question earlier is I think we're sort of in an age where people just think we'll come in, see a provider, and they'll give them a one size fit all quick fix, turn my body around and turn my life around, which we're kind of hoping we get there. But it's also a lifestyle change. So along with this regenerative medicine, we get into this mode where we actually educate our patients on, okay, stop getting yourself inflamed with all these other things you're ingesting and drinking, changing your lifestyle. That's where you make this anti-inflammatory regenerative medicine more beneficial to you. So it becomes a good avenue whereby we educate patients on the therapies available and also about themselves. So we learn about themselves and what they should be avoiding to enhance their lives. So
it was incredible. No, go ahead and finish.
No, I said that was my point of asking as an adjunct in how we treat people. And to your point, it's a holistic, whole mind, whole patient evaluation and addressing their concerns.
It's we also do weight loss, and we'll get people coming in and struggling. They've been struggling with their weight since they were teenagers. Matter of fact, we have a teenager in our office now who's 13 and is probably 60 pounds overweight. And nobody's ever talked to her about diet changes and exercise and things like that. I mean, they just, they thought that she knew it, but nobody really ever sat her down and talked to her about it. So we're working with that, and we put her on a little bit of semaglutide, and she's lost like 20 pounds in a month and feels better about herself, and she's not getting picked on as much at school, and it's a game changer.
So we have 4 medical professionals here, right? And we've all been educated in Western medicine, I would say. And so there's some dogma that I think when you're doing regenerative medicine, you have to unlearn. And there's some misconceptions and stigmas around regenerative medicine that I think really prevents it being used and utilized in a way that is mindful and progressive. So how do we debunk them? Because, there are a lot of people that could benefit that aren't.
Yeah, and you're absolutely right. I think that's a significant issue for multiple reasons. I think I'll start with the easiest one, and the easiest one actually, I mean, I was a victim, or I fell into that trap back in the early 2000s, 2004, 2005. We had a couple different modalities. Obviously, PRP was just coming into its own around that time. And we also had acoustic wave therapy coming in around that time. I got my first acoustic wave machine in 2004. But the problem as a physician at that time is I didn't know how to ask patients for money. They were things that were not covered by insurance. And because they weren't covered by insurance, we didn't know how to ask a patient to pay for it. So we just didn't use it, or we gave it away for free. And I would guess the first 100 PRP injections that I did in my practice, I didn't charge the patients for. I told them I would do it, and if they got better, great. And if they didn't get better, they could come back, and I give them a cortisone shot, and I charge their insurance. And now we know how bad cortisone is, and nobody should be using it. Nobody should be injecting it. But I think we had the stigma that if insurance didn't pay for it, then it wasn't any good, and it wasn't traditional medicine. And I think there's still patients that feel that way. Is like, oh well, if my insurance company isn't going to cover it, it must not be any good. But there's 17,000 studies on PubMed about PRP and how it works, and so there definitely it works. We just have to get over that stigma of being able to talk about it and to talk about patients, that it's not covered, but it works, and they need to pay for it if they want to get better that way, and not through traditional Western medicine.
And so that's, education, right? And helping people really understand how it can help them. Because to your point, insurance is not paying for anything really for sexual wellness for women. And it's limited in what it will actually pay for sexual wellness for men. We look at like
Viagra.
Testosterone, which is hormone pellets for men, and insurance has a cap, whether it actually is enough for you or not. So, that's promoting education. But what are some of the ways that we can use regenerative medicine for sexual wellness, for sexual health and well-being?
Well, yeah, I think that, as I was speaking of before, when I got my first acoustic wave machine back in 2004, once again, it was directed towards orthopedics. We used it for plantar fasciitis and Achilles tendonitis and tennis elbow, and it worked great, but insurance didn't cover it. So it sat in the corner. And it wasn't until around 2010, Richard Gaines decided that the technology, which increases blood flow, increases nerve endings, said, well, a good place for that would be the penis. And so he started the Gaines Wave program using acoustic wave for ED, and it was very successful. So now we had that modality. And then right around the same time, Dr. Runnels was injecting PRP into the vagina for the O shot, which was helping with orgasm. It was helping with urinary stress incontinence. And then he got the courage to inject himself and inject it into his penis, and found out that it helped with erectile function, made it better, made the erection stronger. And so now, if we look at the entire regenerative field, I mean, somebody comes in and they're broken, their sex life is bad, or, they're not able to please their partner. I mean, we have a whole gamut of starting off looking at their hormones, doing hormone replacement. There's peptides we can use to help augment their sexual response. There's PRP with the O shot and the P shot. There's acoustic wave, both for men and women, to help augment that response. So that whole regenerative platform is now available to really put couples and put families back together.
And I would say, again, coming from traditional medicine, I just was at a conference this past weekend, and we were laying out at that conference some of the options that are available pharmaceutical wise for management of erectile dysfunction. And PRP and acoustic shockwave were listed as investigational. And I think, that's really a shame, because to your point, if you look at, and I am not dismissing anything that pharmaceuticals do, because in our practice, we do use pharmaceuticals also. But when we talk about our own bodies being able to produce healthier tissue that enables us to produce the actions we want to, what's wrong with that? Especially if it is, coming from ourselves. We're using our own PRP, or we're using sound wave to do these things.
No, absolutely.
And so labeling investigational really diminishes and dismisses all of the research that has happened over, to your point, these 20 plus years.
But you're absolutely right. And I think that, part of that, this gives me the chance to jump up on my soapbox, but I think the reason for that is the fact that our healthcare program, our healthcare system in the United States is really controlled by big pharma. And we know that big pharma controls the insurance companies, and if they control the insurance companies, then they're going to control what procedures can be done. And, if we have a procedure that has a 90% success rate in treating erectile dysfunction, and all those men have to go off their PDI-5s, what does that cost big pharma? And so, and you look at that, I always tell my son's freshman in college, and I always tell him, just if you're looking at, if trying to investigate anything, follow the money. And, if you look at that, I mean, big pharma does not want these procedures approved by insurance companies, because if insurance companies cover them, then big pharma loses money, and big pharma doesn't want that. So the chances of any of these procedures ever being covered are probably almost zero, because of the way our healthcare system is.
What do you think about like the financial aspect then for patients? Because you made a really good point earlier. If it's covered by your insurance, you may be as a patient more likely to have a procedure done. If it's not, you may not.
Right.
But in the long run, those things covered by.
Yeah, so I was making an analogy to a patient a few days ago with testosterone replacement and bio-T and all that. And I said, most pharma and insurances do not cover sexual wellness therapies well anyways to begin with. And the copay is very high. And I said, listen, you're getting a bottle of testosterone cypionate for $150 and you're injecting yourself every week, every other week. If you just had a bio-T for whatever, $500, $600, $700, you're still better off and you have a stable testosterone level in your system.
Yeah,
and
it's
you're getting
not
this done
fluctuating
3 times a year. So you're still going to spend that money, and it's all educating patients as far as the numbers go, because overall they're spending less than they would ordinarily even going through their insurance, because many of these therapies for EDs and other things are very expensive and insurance don't cover them.
Yeah.
Right. Yeah, I mean, I think it's all about re-educating your patients. It's all about education. And we get, obviously, and you do as well, you get patients in the office that come in and they want to talk about a problem, and as you talk about it, you give them an option, and then you come to the end where you have to talk about the financial part, and it's like, well, I'm not sure I can afford that. And then I think you've got to then take that conversation and you've got to turn it into the real world in a couple ways. I think you have to turn it into the real world and say, well, you're saying it's expensive, but what's your relationship worth?
Mm-hmm.
If you and your spouse wanted to get away for a weekend away to, just rediscover each other, and you're going to spend a couple $1,000 at the minimum to go away for a nice long weekend and hotels and restaurants and whatnot. I mean, your relationship is worth that. So why isn't it worth putting that same $2,000 into care that's going to make your body function better so you can be more sexually intimate with each other? And then also throw it into, I tell patients all the time when they say, well, that's a lot of money. And I say, well, it's about the same price as putting a new set of tires on your car. You'll put a new set of tires on your car, so why wouldn't you do this?
That's true.
And then that throws it into kind of the real world where they understand, and obviously if they can't afford to put new tires on their car, then they probably aren't in a situation to have these kind of procedures done. And those are some people that maybe you just need to do it for free because they need it.
Yeah. I mean, because ultimately, again, the goal is always to make your patients healthier,
Absolutely.
And to give them a better stance on their lives, and it's really paying it forward. And I think it's the value, to your point. Where is the value placed? I know for us women, we oftentimes place value in people outside, people other than ourselves. And so we may value, or we have our husbands or our children or our loved ones have more benefit and not really place value on our own happiness and well-being. And that includes sexual well-being. We have so many patients for hormone therapy who have not really thought about what is it like to really be better hormonally, with testosterone and estrogen, and really take that time to think about where they're coming from and how depleted they are, because we have normalized being depleted.
Yeah, right. No,
normalizing being filled.
We had a young lady that Jennifer has known for probably 20 years come into the office not too long ago for hormone replacement, and obviously had a really low testosterone level, and we're starting to treat those issues, and she had an orgasm for like the first time in forever. Like called Jennifer all excited about the change in her life, and she for the longest time just lived with it because she thought it was normal.
Yeah.
So, but again, debunking things again, that's another debunking theory, which is men and women don't even know they need testosterone. They're like, well,
Right.
that's for men. Your body needs testosterone. It's estrogen, it's testosterone. So,
I mean, Jennifer, go ahead and tell your story about your struggle with perimenopause. I mean, just and how awful traditional medicine was to you.
I had some issues as far as like menstrual bleeding, pain, other symptoms that like heart palpitation, hives, and it was just kind of brushed off. Like, here's a pill for your heart palpitation. Here's a pill to help with the hives. Like, nobody checked hormones. Oh, you're having irregular bleeding. We'll just do an ablation. Like, nothing. And so I was dealing with this for about 3 years, and I finally talked to a friend who's an OBGYN and told her, and she said, has anyone checked your hormones yet? And I was like, no. So we checked my hormones, and they were way off. And she told me at that point that I was pretty much in menopause.
Yeah.
And she said, let's get your
in her late
hormones
40s.
Yeah.
Yes. But no one wanted to hear it when I was like 42, 43. It was like, yeah.
It's just part of aging. Just part of aging.
So since I've got my hormones regulated, I'm off the metoprolol for heart palpitations. I just take magnesium supplements to kind of help that. And no more hives. Don't have to worry about random hives anymore, and just feel better. I've managed to lose weight. I don't have that horrible joint pain, and just so much better. So I can tell
about it's just polypharmacy. We bandaging things. It's polypharmacy, and we're treating all the different symptoms. We're just treating the human being and the issue, addressing the whole issue. We're treating individual symptoms, and I think this is where regenerative medicine comes into play, and someone willing to spend time to listen to your story and think through this with you versus the traditional medicine, you got 10-15 minutes to talk to you about your whole life, and nobody has time to that because 3/4 of the time they're typing away and figuring out what medication to give you.
Right.
So, so if you could, and I think you already sort of listed some of them, if you could list the regenerative therapies you guys have in your practice and just the indication, so that somebody on layman listening can say, oh, I heard about this. This could help me for this. Could you guys do that?
Yeah, absolutely. I mean, so it starts off, hormone replacement therapy, physician-assisted weight loss, PRP for sexual health, so O-shot, P-shot, PRP for aesthetics, so facials, facelifts, breast lifts, and then PRP and or stem cells, fat-derived or bone marrow-derived stem cells for rotator cuff arthritis in the knee, arthritis in the hip, tendinitis, sports-related injuries, anything where we can regenerate tissue in the orthopedic field.
Very good.
And let me say this one thing about testosterone. It is a lie from the depths that women don't need testosterone.
No, absolutely.
And the mere fact that is the main understanding in this country when we talk about hormone replacement therapy, we are doing such a disservice to all women by just talking about estrogen, just talking about progesterone, and forgetting a whole component that helps all the hormones work together. Because if we didn't need testosterone, we wouldn't be producing it.
Right. No, absolutely. Yeah. And we see that we just had somebody in the office this week with a female with a testosterone level of 11. It's like, oh, well, I don't know why I'm not able to, enjoy sex and orgasm. Well, because she's depressed and putting weight on.
And gaining weight and have no energy. My legs hurt. All those things. My skin is horrible. It's vitality. So I have had, because we all work on ourselves.
Right. Oh, absolutely.
And I think, that's one thing that I've really enjoyed about going into regenerative medicine and making it more a part of the sexual health practice in our clinic. I had a no shot And the difference for me was completely night and day. Jeff, you say it, 3 weeks you feel something, 3 months you're at your pinnacle, right? For that injection, and right on the money. You need to give your body the things it needs to regenerate tissues.
Right.
You need to drink water. You need to eat well. You need to have those vitamin cofactors and all that other, and you need to use it, right? You need to have blood go down to the area. But it was night and day, from lubrication to sensitivity, and it made me feel like a person again, like a woman again. It made me have more confidence in who I am, sexually, and also just as a woman. And so what I thought to myself was, and by this time that I'd had the O shot, I'd already done multiple O shots, but just had not had my own. And I thought to myself, all these years of practicing, I've been practicing with one hand behind my back. When I talk about, when I'm helping my patients with their sexual lives, I'm practicing with one hand behind my back, a big tool in the arsenal, just not utilizing it for, a number of reasons. And so we can really, with somebody's own tissue, take them from zero, from the Sahara, all the way to the Amazon.
Yeah.
With one simple procedure. And it's amazing. It's amazing to me that it's something that we're not talking about more, and people aren't demanding more.
Well, again, to your point, it's they're not aware of it. It's not in the textbook. It's not in the mainstream media. And so if you don't know, you don't ask.
Well, and sometimes it's the doctor's issue as well. I just read a study not too long ago, and it was a study out of all the hospitals in Philadelphia, and they said that only 40% of OBGYNs ask their female patients about their sexual response.
Of course,
40%.
40 is even high. I would think 40 is high.
You're right. That one hospital was as low as 17.
Yeah.
Well, I tell you why. Because we spend the majority of our education delivering
and doing cancer.
Well,
yeah, that's
okay. So we don't spend the majority of our education understanding, Jennifer, to your point, menopause and perimenopause, and really having the conversations where we should. We don't spend the majority of our education talking about about just life outside of the fertile stage and the cancer screening. And that is, we're doing a disservice, because we're supposed to be the women's health expert. We're supposed to be the women's champion, and we are doing a big disservice to our population, are those that we're supposed to be caring for, because we're forgetting a whole span of their lives. Sex is not just important for. I'm about to get on my soapbox.
Good.
Sex is not just important for fertility. Pharma figured that out for men a long time ago, right?
That's right.
Yeah.
That's right.
But for us women, we've relegated it to, it's just important for you to get pregnant, and you need this lube to help you with pre-seed, and that's it. Not this lube that's going to make it feel better, that's going to increase your sensitivity. Not this medication that's going to increase your drive. Nope, you just need this lube that's going to get that sperm where it needs to go, get you pregnant, and you move on. And so we are doing such a big disservice, because there's 4 years that we spend training, and we're training for just a couple of things.
Yeah.
And you can take the average resident out of residency and ask them about menopausal medicine. They're not able to do it. That's something you need to go figure out after.
Yeah.
And I can tell you, with just a month, 2 months, if that long, in my program, where sexual health was something that we concentrated on. So, that 40%, that's high. That's high. That study I must have been in that study.
Dr. Runnels on his webinar last night, and I don't remember what the number was, but it was like crazy low, like close to zero.
Yeah.
But they did a poll of like teaching programs, medical school teaching programs all over the country. What percentage of medical students are taught how to examine the clitoris?
Oh,
Probably none.
Almost zero. Yeah.
Probably
Almost
not.
zero. Well,
Yeah.
even you. So you did an OBGYN residency.
mm-hmm.
Did you learn how to examine the clitoris?
No. No. All, that for me, all of my training for sexual health and menopause has been post residency.
Yeah.
It's been me seeking it out. It's been post residency.
And
It's not
it's
been
sad to think of that. Well, even if we look at big pharma, there's one drug for female sexual response,
Mm-hmm.
and it's essentially an antidepressant, flibanserin.
Mm-hmm. Yeah.
Well, that's great.
Yeah.
I mean, so I think just getting this word out and people attuning to the body and learning alternative medicine, regenerative medicine is going to go a long way. It's going quite slowly. I mean, like you said, this is 20 years in the making, and we're still a little bit relegated to off-label use. It's going to take a while,
It is.
but we're getting there, and we're getting the word out there. And patients need to start putting value. I mean, I tell them, like your 2 point, you got to put a dollar value to something. If you think the polypharmacy box of medicines you carry around is going to cure all the one major issue you have versus the 20 symptoms you're bandaging, I think we have totally missed the boat. And to Mary's point, we're doing them a disservice.
You're absolutely right.
And once you start addressing the main issue, then you get rid of all these pills. They feel better. You address each and every one of their concerns. So before she gets carried away, I was trying to pin Mary down and have her list the regenerative therapies she has that we offer at Climax Aesthetic Surgery also, and the indication. So people out here, at least in our local community here, can hear it.
Well, because I'm under the tutelage of Dr. Jeff.
Yes.
Whatever Jeff does, I do.
There you go. Amen.
He's my guiding light.
Thanks. You know, I was thinking when I first got the email that I was going to be on here, I was thinking back about when I was doing conventional ortho, and I remembered one case that now I look back and I kind of chuckle, and it would be weird like if this girl was on this, watching this somehow or somehow stumbles upon this, but I had probably been in way before I was doing regenerative medicine. I was probably out of residency, maybe 4 or 5 years. And I had this 22-year-old girl come into my practice, and she was with her mom and her fiance at the time. And they were about to get married. And she had congenital hip dysplasia when she was born. And she could not abduct her hips far enough to have intercourse. Mm. And so they came to me prior to their wedding to see if at 22, if I was willing to do bilateral hip replacements, so she could get her legs apart and have sex on her honeymoon. And absolutely did it without a second thought. I said, yes, absolutely. There's no doubt. If we can get your insurance to cover it, you can't do them both at the same time. We'll do one. We'll wait 3 months. We'll do the other one. We'll have you good to go by the time you get married. And so she did. She ended up having a baby. They sent us a picture and a card. Everything is good. But now I look back. I mean, this was 30 years ago. Mm-hmm. And now I look back and think, there's probably so much else I could have done today that I didn't have in my toolbox back then.
Yeah. I mean, we're grateful. We're grateful that science has put us in this place, and we believe science, and, we're using it. And just with that, what are some of the insights to the future of regenerative medicine?
I think
so if she was here now, what would you have for her?
Oh, if she was here now, I mean, probably it's something that we even have available today. But if she came in today, we have an injection called alpha-2 macroglobulin, or A2M. A2M is, without getting too scientific on this call, we know that patients that have arthritis, degenerative arthritis in a joint, they have a very high level of something called MMP13. And MMP13 is a protease. It breaks down protein. Mm-hmm. So it breaks down articular cartilage. And so we do have a variant of PRP that we can run through a filter, which is called alpha-2 macroglobulin. And it binds MMP13. So it can actually stop the arthritic process at that point. And so once you stop the degeneration, then you can work on regenerating after that. And it was discovered in athletes that undergo ACL reconstructions, because we know that if somebody has an ACL reconstruction on their knee, in 20 years, they will have degenerative joint disease. There's nothing we can do about it. Even if the surgery goes perfectly, the longevity is at 20 years. That's what's going to happen. And now we know there's an injection that we can use to stop that from happening. So with a girl like that, we would, probably early on, hopefully somebody would have picked it up early in her life when she was still a child and injected her with alpha-2 macroglobulin, stopped the degeneration, kept the hips moving, used PRP, and she would have never gotten to that situation in the first place. I think in the future, I still think that, stem cells are going to happen. They were banned a little over a year and a half ago because none of the companies that were manufacturing got FDA approval. We have a couple people that are in almost ready to finish phase 3 of their study. So once that comes out, all the products derived from placenta, whether it be periumbilical stem cells or exosomes or amnion, that's all going to be available to us, and it's just going to push things even farther into the future.
I could talk to you forever about this. I'm going to, for myself, ask one more question.
Okay.
About acoustic sound wave.
Okay.
And the regenerative properties from that. How much do you think you can get?
I think you can get a lot. I'll first, before I even, I'll quote the original study that Richard Gaines did. So when Richard Gaines did his original study, he had 100 men with no tumescence. So they did not get erections with pornography, with waking up in the morning, with sexual intercourse, no tumescence. And they treated them with 6 treatments of acoustic wave, and 60% were able to get enough erection that they could penetrate. So, that's this original study for the Gaines wave. And so talking about that, I think that using that as an adjunct to everything we do, and Jennifer will tell you, she's kind of our acoustic wave expert. I don't think a patient comes into our office for a regenerative procedure that doesn't get acoustic wave first, whether it's an O shot, a P shot, rotator cuff, knee arthritis, tendinitis in the ankle. We start with that. And the reason being is 3 big things happen. One is the acoustic wave causes enough inflammation that it causes regeneration of vasculature. So arteries start growing that feeds the area with new blood supply and new stem cells. It increases nitrogen at the tissue level. That nitrogen binds with oxygen and forms nitric oxide, which attracts stem cells to that area. And then it breaks up any calcium deposits within any of the small arterioles, especially in the penis, and allows more blood flow to those areas. So I think with all of that, it's a perfect adjunct to everything we do.
And so, because of that, we've started actually using it in our own practice too, for all of our procedures, including our surgeries. And I'm telling you, the way our patients are healing after their procedure, after their surgery, it's amazing. It's amazing. Pre-surgery, do some sound wave, acoustic shock wave, do your surgery. They're coming in week 1. The way that tissue is just regenerating, and
you're already starting the healing process because you have a little bit of inflammation and you have increased blood flow.
Yeah. So it's a great tool in the arsenal. Thank y'all so much for being with us.
Thank you for inviting me. I was so excited when I got that email.
Yeah. You're welcome. Our OG of PRP.
Regen.
Of regenerative medicine. Yeah. Thank you for enlightening us. Thank you for educating us. And also to both of you, Thank you for being trailblazers
Well, thank you.
that we're able to learn from. And hopefully we continue to get this message out there that regenerative medicine is not only good for sexual health, sexual well-being and intimacy, because it really is, but that it is good for overall well-being. And so we should
Absolutely.
really be taking care of ourselves.
I'm actually working on a little video that you'll probably get in the next week or so of an article that just came out about how regenerative medicine and PRP can add to longevity. And it's pretty exciting. So I'm shooting a little video and going over the research. And so you'll get it very shortly.
I look forward to it.
Yes.
I look forward to it. Jeff and Jennifer, thank you for joining us.
Thanks for having
Thank
us.
you for joining us.
Nice seeing you guys again.
Nice to see y'all. And this is Climax After Dark.